Hi, I'm Cindy with the Parkinsons Resource Center. Welcome to our first telehealth of 2013. We appreciate you making it here today with all this beautiful winter Spokane weather. And today we're going to do our telehealth with Carla Carnegie, who is music therapist, board certified. And Carla has been doing a drumming for wellness for here in Spokane and several other things over the last fall. She got her degree, about a year ago.
February.
And the drumming for wellness is some of the things you'll be doing today. But we're very excited. First, though, I do want to say thank you to St. Luke's for having us here again. We're always thankful that we get to partner with them, and we also want to thank the Northwest Parkinson's Foundation with their help and cooperation. We're able to do this monthly also, and thank all of our donors who keep us going so that we can provide this program for free for everybody who comes and for all the sites. And I'm going to turn it over to Carla, and we'll do the question and answer afterwards, so hold your questions for then.
Cool.
Thank you.
Thank you, Cindy, and thank you everyone for having me. Thank you for the Parkinson's Disease Resource Center for inviting me to talk today. And I'm hoping that wherever you are watching this, that after you've seen what you're going to see here in a few minutes, you'll be able to find a music therapist to help you with your Parkinson's symptoms and find the benefits of music. I'm so happy and delighted to be able to share my passion of music and what music therapy can do for folks. In this case, particularly today with Parkinson's disease. So what is music therapy? Music therapy is an allied health profession that uses the elements of music, whether that's rhythm or harmony or melody, timbre, dynamics, etc., in a therapeutic relationship between an individual or a group of individuals and a qualified board-certified music therapist who addresses the goals and objectives of the client or clients so that the potentials of each person individually are developed and or the functions of each person can be maintained or improved. Music therapy is a recognized health modality often used in tandem with physical therapy, occupational therapy, and speech therapy. It's clinically and evidence-based, and I want to just give you a couple of quotes from what the research shows, in particular with Parkinson's disease. The research shows that the effects of a music therapy protocol for individuals with Parkinson's disease can improve voice quality, volume, speech intelligibility, positive affect over time, and a decrease in depression and negative affect. Studies show that auditory cues, such as you'd have with the rhythmic cues, as in just a metronome beat, or rhythmic cues in music that are embedded in the music, can improve the cadence and velocity of walking and reduce the shuffling and freezing that patients with PD often experience. Research shows that music improves the rhythmic limb movements, the gait, and shows an increase in motivation, and is demonstrated to be effective in reducing anxiety and modifying release of stress hormones. This is good for everybody, whether you have PD or not. We all have lots of stress, and modifying the release of those stress hormones is an important health aspect. And reducing anxiety is related to everyone, not just Parkinson's disease. So in my drumming for wellness, that's why I call it drumming for wellness and joy. It's not just for folks with PD, but for everyone who would like to experience better health and have fun and enjoyment and reduce stress. The use of instruments is structured to involve all the sensory organs. Rhythmic and melodic components of music can be used to stimulate motor and emotional responses. It's like our DNA is geared for music. Music is processed in the brain, all over the brain, and that is why it's so effective when you have disorders such as Parkinson's or you've had the damage done by a stroke, that you use music to restore function and to maintain function. because music is processed throughout the whole brain, and it makes both hemispheres of the brain talk to each other, and new neural passages can be made, neural connections can be made between the hemispheres and circumvent the damaged areas of the brain to restore functionality. So, qualities of a music therapist. How do you get to be a music therapist? Well, for one, you have to have at least a BA or higher in an approved music therapy program. This is offered over 70 universities across the nation. You have to finish the required psychology courses, modalities that are offered in the counseling fields, neurological courses such as psychology of music, which addresses how music is processed in the brain, anatomy and physiology, and then a load of music classes. I came to the music therapy program with a degree in music already from Whitworth University, and I went to Marylhurst University for my music therapy degree, as it was the closest university that offered an approved program for me here in Spokane. And I knew I wanted to come back to Spokane when I was finished to bring music therapy to y'all. So I needed to be the closest university to Spokane to do that. We also have to be proficient on guitar, piano, percussion, voice. And once we've completed the academic portion of the degree, then we get accepted into an internship, which is a rigorous 1,100 hours, which if you figure out the math, at 40 hours a week, amounts to 6 to 7 months to complete this internship. And then, once we've completed that, we get our degree, and we get to sit for our national board exams to become board-certified music therapists. And this is the credential that's important to practice as a music therapist. There's lots of musicians out there, and their supportive music is a beautiful thing. But just because a person plays music for other folks does not mean that they are a music therapist. And so it's important when you are eliciting the benefits of music therapy that you seek a board-certified music therapist to know how to use music in that therapeutic manner. And then once we have the credential of board-certified music therapist, we have to have continuing education units to maintain that credential. So we stay on the cutting edge of what the research is showing. So we bring best practice to the people that we serve. So examples of therapeutic goals would be an increase in social interaction. Some disorders are isolating. It's hard to get around. It might be hard to communicate. There may be depression involved. So isolation is a huge thing to address. There's a therapeutic goal of increasing self-expression through singing or participating playing instruments. Improve or maintain cognitive skills, including memory, attention, and so on. To reduce stress, improve mood, and decrease anxiety and depression, alleviate pain, and promote overall well-being, physical health, and, I might add, mental health as well. So, particularly with Parkinson's disease, our overall goal is to increase the quality of life, to support the emotional, the psychosocial, the physical, the cognitive, communication, and even the spiritual domains of function. And specifically, Parkinson's disease affects physical and motor functionality. So the objective here is to reduce tension and stress, increase movement of limbs and coordination, and increase respiration and breath support. Moving takes breath. To sing, it takes breath. To speak, it takes breath. So increasing the respiration and breath support is an important component. And increase communication. The objective here is to increase general affect. You know, the freezing or the mask, the Parkinson's mask, we address the muscle and the face, the neck, and the mouth so that you can speak with an increased volume, so you can have better articulation, so you can have improved voice quality. We look at maintaining cognitive skills. The objective here is to support memory and improve focus and attending skills. And we want to support the creative musical side of us. The objective here is just sing for fun, have fun, and self-express. There's music methods that we use, the experiences that we create as music therapists. For one is for inhale, exhale to a drum beat. We're going to be demonstrating these here in a minute, so I'm just going to briefly go through these. Increase abdominal breathing by doing a gut laugh to Jingle Bells, for instance. These are things that I use with dealing with PD. Music movement with live instruments or with a song on the iPod. I wrote a warm-up exercise that I call Bluey, Chewy, Dewy, Fluey to address certain mouth exercises that I saw represented in literature from the Parkinson's Resource Center in Portland, where I was doing my internship. And it said in the instructions to look into the mirror and do these mouth exercises. Suck on a lemon, and then think of just winning the lottery. And, work your facial muscles. Well, doing these funny faces in the mirror, I felt really ridiculous. And I thought, if I feel ridiculous, I'm sure other folks feel ridiculous. And so, as good as an exercise might be, if a person's not motivated to do it, it's not much good. So I thought, and this is where my music degree helps me, compose a warm-up that involves music and uses these very exercises: bluey, chewy, dewy, fluey. It's kind of nonsensical, but it's fun, and it gets the job done. And I put it to a 12-bar blues pattern, and it's just fun. And then to make it a little more cognitively challenging and physically challenging, we can have an instrument to go with it while we're singing this song, and you'll see it demonstrated. Other methods that we might use are singing songs of choice. It's important to sing, if you're going to sing songs that people know and has meaning to them. You all probably wouldn't want to sing Britney Spears music, but y'all might know, Come Around the Mountain, Somewhere Over the Rainbow, that kind of thing. Play a variety of instruments. And I just listed a number of things here that I've used in music therapy. And then sing songs of themes or seasons, with or without lyric sheets. I do both. I know that the music group in Coeur d'Alene appreciates having lyric sheets because they think, my memory just doesn't, I just can't remember words. But part of our goal when we're doing music therapy is to stimulate, through just singing, the remembrance, the memory of some of those lyrics. And so we work on both of these things. And by the way, the group in Coeur d'Alene, they have me come once a week to work with them. I call it for singing. I call the group Singing for Wellness and Joy there. And it's sponsored by the American Parkinson's Disease Association. So just a plug, and thanks to them for their support. All right, so we're going to go back here to this, and I'd like to have my volunteers come up, please, and have a seat. Dean and Barb, if you'll come have a seat here. What we're going to do now is do just a demonstration for you of what we do in a music therapy session that addresses some of these goals that we just talked about in a fun and musical way. Have a seat. Yeah, right. Pull your chair around just a little bit so we have some, eye contact going on. All right. It's time to say hello. It's time to say hello. It's time to say hello, everybody. We'll sing, play some instruments, have a little fun. It's time to say hello to everyone. Hello, G. last week, this is a little warm up our voices a little bit. Since that's a new welcoming song that I just wrote, y'all don't know it yet, but you will. But last week we sang a song called Edelweiss, didn't we, Shirley? You know Edelweiss? No. Okay, let's just warm up our voices a little bit, and you all in the audience can sing along with us too. So we're going to sit nice and straight in our seats, our feet planted firmly on the floor, and I'm going to give us a little drum beat. So what we're going to do is we're going to breathe in on the count of 4, breathing out on the count of 6. Inhaling on the count of 4, exhaling on the count of 6. So I'm going to give us a 4 count beat. And 1, 2, 3, 4. Now inhale. And exhale. Inhale. And exhale. Now what we're going to do is inhale on 4 and exhale on 8. I'm going to slow this down just a little bit so that you can maintain your air exhaling so that when you're done, you've completely exhaled your lungs of air on the count, at the count of 8, okay? So here we go. And inhale. And exhale. And inhale. And exhale. One more time. And inhale. And exhale. Let's do a little shoulder shrugs. Go forward. Shrug your shoulders, roll them forward, and roll them back. Loosen up your shoulders. It's all part of the breath support goal here. All right, and now we're going to take our shoulders and bring them up to our ears and hold the tension, hold it, and release. And let's do that again. Pull our shoulders up to our ears and hold the tension and release. Y'all are doing it. This is wonderful. Okay, one more time. Bring it up to the ears and hold that. Tense, 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 and release. Good. Now we're going to turn our torso and look over our right shoulder. Pick a point on the wall. Hold it for just a minute. You're going to feel the stretching through your neck here. And back to the center. And now looking over your left shoulder, feel the stretch down the right side of your neck. And back to the center. One more time over to the right shoulder. And back to the center. Now looking left again, still sitting tall. Look over your left shoulder. And back to the center. Now we're going to take our head and go up to the ceiling. Feel the neck stretch here. And now we're going to put the chin to the chest. Feel the back of the neck stretch. Good. This time breathe in as you look up to the ceiling. And out. Now Now chin to the chest. And out. Now I want you to put your hands on your belly and feel your diaphragmatic muscles at work. They're going to be expanding this way and this way. It's not raising the shoulders to breathe. It's letting your lungs expand and your rib cage move out. So let's take a nice deep breath again. In and out. Good. One more time. And out. Very nice. So we're going to do now a little keeping our hands on our diaphragm here. Controlled breathing with he, ha, 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 ho, 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 hoo. Okay, we're going to do it to jingle bells. Okay, here we go. And breathing in. He, ha, 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 ho, 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 hoo. He, ha, 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 ho, 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 hoo. He, ha, 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 ho, 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 hoo. He, ha, 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 ho, 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 hoo. Good. All right. Now, let's do a little bit more, just overall body loosening up, something fun. Would you like to have a handle or just regular? The shakers here. All right. How about you, Jean? One with a handle or one with a handle? All right.
Handle, please.
Okay. All right. So we're gonna shake, rattle, roll. Shake, rattle, and roll. I'm gonna shake, rattle, and roll. Gonna shake, rattle, and roll. I'm gonna shake, 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 rattle, and roll. I'm gonna shake up high, good. Gonna shake up high. Gonna shake down low. I'm gonna shake down low. I'm gonna shake, 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 rattle and roll. Other hand. Gonna shake, rattle and roll. I'm 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 gonna shake, 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 rattle and roll. Get up high. Gonna shake up high. Gonna shake up high. Now low, down low. I'm gonna shake down low. I'm gonna shake, 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 rattle and roll. Now kick a leg. Kick that leg. Gonna kick that leg. Now the other leg. Kick that leg. Gonna kick that leg. I'm gonna shake, 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 rattle and roll. I'm gonna shake, 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 rattle and roll. Good. And we can stretch that out doing lots of different movements for the body with just something fun as a shaker and moving. And often I accompany on the guitar, so you have a melodic and harmonic element to go with that. It's very fun. All right. So now let's do our muscle warm-ups and our face.
Are we going to do that egg thing?
No, we're going to, not that one.
Oh.
Barbara's been to one of my Drumming for Wellness and Joy, and she was asking if we were going to do the take, shake, and pass with the egg shakers. Game. It's a musical game. But no, we're not going to do that one today. But it's fun, isn't it?
It is fun.
Okay, so what I want us to do now is just be aware of our facial muscles. Let's massage those cheek muscles and loosen up. And feel like you've just taken a big wad of gum. You can make a sound if you want. Yeah, good. And now we're going to suck on a lemon. So suck on that lemon. And you just won the lottery. And suck on the lemon. And you won the lottery.
Whoa. You got to tell us how to win the lottery?
No. Sorry. That's out of my scope of practice as a music therapist. Okay, one more time, Gene. We're going to suck on that lemon. And now, if you were looking at yourself in the mirror, you'd feel so ridiculous. Look at us all here together in this room, and it's perfectly fine. We're looking at each other, and we're having a really good time, right? So it's not near so bad. Okay. And now, let's do the breathing in, and we're going to go, ah, stretching our jaw open, letting the jaw fall, ah. Notice where your tongue is. You want to make sure that it's forward, not back in the throat, because we're going to do vocalization with this. So breathing in. Here we go. In again. Open as wide as you can. Feel the stretch. Yeah, good. I'm glad I don't have to look at myself. I know I'm looking like this. Okay, so here we go. In and out. Okay, good. Are we ready for some bluey, chewy, dewy fluid? B, C, D, and F. Okay, I'm going to give you the tune here. Bluey, chewy, dewy, bluey, bluey, chewy, dewy, bluey, chewy, dewy, bluey, chewy, dewy, bluey, chewy, dewy, bluey. Don't worry if you get those words mixed up. That's not important. The important part is just doing those syllables, okay? Because we're working those muscles in the mouth and the cheeks, okay? Here we go. Bluey, chewy, dewy, bluey, chewy, dewy, bluey, chewy, dewy, bluey, chewy, dewy, bluey, chewy, dewy. All right, nicely done. I'm glad you all were participating there. And then, like I said, you can make that a little more challenging with an instrument while you're doing it, and then you can start moving, you know, jiving in your chair. When you're singing it, you can make it really fun. All right, so I'm going to pass out some drums, and we'll do a little drumming here. What size would you like? Okay.
I like the pancake lot.
How about you? Little one? The littlest one? Okay, thank you. How about you, Shirley? Is that good?
That's fine.
All right. Okay, so I'm going to do a pattern, and you're going to do one after me.
Oh, together?
Yeah, all of you together. Now you're my turn. My turn. All of us together. Join with me. we're just doing a demonstration today, so my typical music therapy time is about 50 minutes. And so we go through a whole series of different things like this over that period of time. And so we really get some good work done in that amount of time. Okay, so I'll collect your drums, and we're going to do our last song. This is like the fastest music therapy session I've ever done. And I'll collect your drums for you and give you a lyric sheet.
Don't use the right bend-aid.
Okay, this is called Sing Your Way Home. And I like to end our Singing for Wellness and Joy with our group in Fort Lane with this song. Here's how it goes. Sing your
Way home at the close of the day. Sing your way home, drive the shadows away. Smile every mile, for wherever you roam, it will brighten your road, it will lighten your load, if you sing your way home.
Good, let's do it again.
Sing your way home at the close of the day. Sing your way home, drive the shadows away. Smile every mile, for wherever you roam, it will brighten your road, it will lighten your load, if you sing your way home. Thank you.
Nice. All right. So what's different about my Drumming for Wellness and Joy classes, and I'm doing one right now at East Valley Presbyterian Church on the first or second, let's see, is it the first or second Thursday of the month. The next one will be January 24th, and then February 7th and 28th. These are a free community event that I'm doing there, and East Valley Presbyterian Church is located in Spokane Valley on North 5305 Harvard Road from 6:30 to 7:30. No musical ability is required. It's for all ages and for everyone, but it's really, really fun, isn't it? Barb and Jean have been coming to the ones at another location that I was doing for several weeks and just had a blast. And we do more percussive things, and we do a few chants and do more percussive games, musical games, and yeah, it's really fun, isn't it? So y'all are welcome to come out to this community event called Drumming for Wellness and Joy. All right, now I'm going to go back to the PowerPoint here. All right, and this is my reference page for the quotes that I had for research. And for more information and to find a music therapist board certified in your area, you can go to the American Music Therapy Association at www.musictherapy.org. The Music Therapy Association of Washington is www.musictherapywa.org. The Oregon Music Therapy Association is www.oamt.org. And my website has just become live today, so I'm so excited. Please go to my website. It's willowsongmusictherapy.com, and I will be posting blogs on there that will give you more detail about how the brain functions with music, what happens, and how that is in more depth so beneficial for dealing with the symptoms and issues of PD. And thank you very much for having me again. It's been a pleasure. And thank you to my volunteers. Thank you.
Carla. also want to mention too that Carla is doing a weekly music
Oh, yeah.
therapy program at the Parkinsons Resource Center. On Thursdays, we're adjusting the times to make sure that if people want to get to a couple programs going on Thursdays, that we can get them to everything. But this one coming up is at 2:15 on Thursday at the Parkinsons Resource Center in the Deaconess Health and Education Building. Next month is going to be some tips for nutrition and Parkinson's disease. March is going to be research on the cause and possible ways of not getting Parkinson's disease in the future. We have a doctor from University of Washington actually coming to Spokane to speak for us. And then Parkinson's Awareness Month is in April, and we're going to have a Parkinson's panel of people in the Parkinson's community. So we look forward to having you here, and thank you again.
Thank you.